For those of you who don't know or aren't very familiar with MMA, we founded it about 18 months ago in October of 2016. And this is a really interesting alliance because it's comprised of Medicaid beneficiaries and then supporters from around the country, including more than 100 national and regional organizations.
Currently, about 75% of the Medicaid enrollees are in managed care, 25% in fee-for-service. However, only 50% of the costs are currently in managed care, the other 50% still in fee-for-service. My viewpoint is we need to figure out another solution to curbing the Medicaid cost trend outside of just trying to eliminate people from the program. So we built these health and wellness centers where we do nurse case management, on-site care coordination. We have on-site pharmacists do face-to-face MTM, one-on-one education, group education. It's all of this very, a lot of activities, because our viewpoint is once we make a connection with a member personally, that we get them to change their healthcare behaviors, and we also learn more about them, like their social issues.
People are reminded, they are brought up short when they suddenly confront sort of radical surgery to Medicaid. They are reminded of what an indispensable program it is. So, of course, it's a huge program.
So I think we saw from last year with the debates coming out of Congress what people think about Medicaid, and I think there was a new awareness of what the program is doing. It's the biggest payer for behavioral health and long-term services and supports. Other programs are not covering those services, and as our population ages, Medicaid is going to continue to play a huge role.
About 20%, 1 in 5 people have some kind of Medicaid coverage these days. It provides people with ongoing access, particularly children, ongoing access to primary care and preventive care services, to participate in education, participate in the labor force, all of that good stuff that everybody takes for granted.
But I think the real excitement for me is going to be, how well can we work with the administration to really unleash the power of states in their efforts to do delivery system and payment reforms. This is what it's going to take to really fix the healthcare system.
In the rural space, the rural providers don't want to be left behind. They want to be a part of innovation. They don't want to be told, you just keep going with the current system because it's working. Because the reality is there's been changes in the way that medicine is practiced. How do we keep the necessary healthcare within rural communities while this change is happening? So we need to find ways to make sure that we can keep emergency departments local, because when you're having a heart attack, it does matter that you can be seen locally. We think that having ways to mix providing innovation to the rural providers and not leaving them behind, but also making sure that these essential access points remain.
We sort of took a market-driven approach to Medicaid. We've seen ER usage go down. We've seen better outcomes health-wise. We've also seen better return on investment for businesses. As more of those lower-income people who are maybe underskilled or underemployed are looking to get back in, this really provides a buffer for businesses to help get them back on their feet and up.
Innovation is necessary when you have legislated and regulated programs that started out 50 years ago, and states are and various stakeholders are confronted with the need to respond agilely to developments like the opioid crisis. In terms of rural health, we're experimenting with providing telehealth access for things like child psychiatry.
We have a nurse practitioner and or physician that comes in that will have a schedule and can actually meet with some of those families, meet with those kids, look at what's going on, and they're getting their health care right there. And what they're really doing for us is helping to keep kids in school.
Medicaid does so many things that are so critical that get so little attention. We cover more than half the births in this country. We cover 40% of all kids. We're the biggest payer of mental health services, the biggest payer of HIV/AIDS treatments, and we are the biggest funder of long-term services and supports. We do a lot, it's critically important, but few people really recognize and appreciate how involved Medicaid is in the healthcare system.